Hey, good afternoon. I'm Dean Schultes. I'm the Senior Vice President for Supply Chain and National Field Operations for Curative. And I just want to first of all just say thanks to all of you for coming here, and thanks to the community for the support. And on behalf of Curative, just to say we're really grateful for the support and the partnerships that we've been able to form here locally with Springfield and with the Commonwealth of Massachusetts. Not only the governor's team, but also the Department of Health, the Department of Transportation, and I'd be remiss if I didn't mention the Massachusetts Army National Guard and Air Guard, who have been incredible partners. I'd also like to recognize the City of Springfield, who has been, just tremendous partners, providing resources to us and being just really a resource, an information resource for us as we put this vaccination site in place. And I'd also really like to recognize the Eastfield Mall. They've been an invaluable partner with us and have allowed us, Dave Thompson over here, have really allowed us to make the incremental changes. In the beginning, some pretty big changes, and then every day we're making incremental changes. And without your support, Dave, it'd be a lot more difficult to pull this thing off. So thank you. Just a little bit of, just a couple facts. So we've administered nearly 14,000 vaccinations here at Springfield Mall, and across the state we'll surpass 25,000 today at our 2 locations. And really, you can't do that on your own. Obviously, you've got to have some good partnerships, which we've been able to do and been able to form rather quickly. As I mentioned, we've made some continuous improvements as we've gone through this thing. We had some lines that formed in the beginning, but again, just kind of going back to reaching out to our partners, both Springfield, working with the governor's team, and also the Eastfield Mall here. We've been able to minimize those lines and really minimize the time that it takes to come in here and to get a vaccination. Our average time currently, yesterday and today, it's under 30 minutes to receive a vaccination. That includes the sign-up time, coming in and checking in. That includes actually going to a table and getting a vaccination, and then going through the observation, the mandatory observation time, which is 15 minutes in most cases. So for those vaccinations, like I said, we're well under 30 minutes. So we've got a very, very smooth operation right now. And we're going to continue to make process improvements. We're not going to stop there. We're going to continue to push forward and make as many changes as we can to not only get that time down, but just make it an enjoyable experience. Well, I mean, as enjoyable as getting a shot in your arm can be. So again, we'll be working with the community here in the Eastfield Mall and everyone to continue with that. Curative is an end-to-end solution, and some of those incremental changes that we've made are not just here on the ground, but also our software, our hiring processes, our logistics, our cold chain supply, all of that. We've been able to kind of get in and make changes, and we've relied on our experience as a COVID testing company across the United States. Just a little background: we've done over 16 million tests so far, and we're again just really proud to be a part of this process and to provide vaccinations to the Commonwealth of Massachusetts. Okay, well, I know you guys didn't come here to hear me talk, so I think with that I'm going to introduce Mayor Sarno from Springfield. So, sir, it's all yours.
Thank you very much. Thank you, Dean, very much, and to Governor Baker. It's always great to have you back here in Springfield. He's been a good friend, not only myself, but the city of Springfield. And I want to thank Dean Schultes of Curative and Dave Thompson, Eastfield Mall, and Governor Baker and his team. We've worked very, very closely to completely turn around the issue here. It is running very, very smooth. A number of phone calls from seniors to my office, home, here, when I'm out and about, and they're very, very appreciative. I am very appreciative that Governor Baker has put a mass vaccination site right here in the city of Springfield. His goal, like mine, we want to make sure we get as many shots in people's arms as we can as quickly as possible. That's the bottom line on this, because we will defeat this COVID-19. So without further ado, again, it's always a pleasure to have him back in the city of Springfield. He is a frequent visitor here in the city of Springfield, and he's going to continue to garner supply from the federal level and get it down to our cities and towns. Our governor, my friend, Charlie Baker.
Thanks, Mr. Mayor. It's good to see you.
Happy Valentine's Day, too. Don't forget your sweetheart.
My wife's birthday is actually 2 days after Valentine's Day, so it would be virtually impossible for me to forget that one. Good afternoon. I'm thrilled to be here today in Springfield to talk to the folks here about the operations at the Mass Vaccination Center with the folks from Curative and with the mayor and the folks on his team. Before I talk about that, I do want to give my daily update on COVID. Yesterday, the Department of Public Health reported 2,228 new cases of COVID. That was on a 106,107 new tests that were reported. A total of over 14.7 million tests have been done here in the Commonwealth and reported. Our hospital numbers, like our testing numbers, our positive test numbers, continue to fall. Yesterday, there were 1,223 individuals being treated in the hospital for COVID. That's down by a significant amount since the beginning of January, and there were 300 that were being treated in the ICU. We're clearly making significant progress in reducing the amount of COVID in our communities across the Commonwealth, and that obviously has had very positive impacts on our hospital and our healthcare system. We now have one of the 10 lowest COVID positive test rates in the country, and we continue to be a national leader in testing, even though we also have one of the lowest new daily case rates in the Northeast. Yesterday, the Commonwealth passed a major milestone with respect to COVID vaccinations. We went over 1 million doses of vaccines that have been administered to residents here since this program began at the end of December. We've surpassed the first benchmark that we set for phase 2 vaccinations, which was to be able to do 242,000 doses a week. We're actually number 9 in the country right now in terms of daily doses administered by state. We're rapidly making progress to continue to expand the Commonwealth's vaccine infrastructure, and we're now, as I said, a top 15 state for the percentage of first doses that have been administered. It's actually number 9. My remarks say top 15. I appreciate the decision you guys made to be a little conservative in that estimate. We've actually increased vaccine administration by over 50% over the last 10 days. We've added over 100,000 new appointments this week across our mass vaccination sites and our pharmacy sites, and there are currently over 170 vaccination sites across Massachusetts. And this week we also announced that 2 more mass vaccination sites will be opening by the end of the month. One will be in Natick and the other will be in Dartmouth. Our goal remains to get as many of our folks here in the Commonwealth vaccinated as efficiently and as safely as we possibly can. And we took extra care to prioritize vaccines for frontline healthcare workers when this process began, for first responders, and for many of our other most vulnerable residents, including people with developmental disabilities in congregate care settings, folks with mental health issues in congregate care settings, folks who work and are in our homeless shelters here in Massachusetts were also part of the first group that we worked with straight out of the gate. And obviously, we've been busy vaccinating both seniors and staff in long-term care facilities. We actually have, at this point in time, we've been 2 trips through our long-term care system. We're currently in the process of going through for the 3rd time. We vaccinated so far about 90% of the residents in our skilled nursing facilities in Massachusetts, and about 70% of staff, which actually is significantly higher than the national average with respect to staff vaccinations. And we're really pleased, given all the issues in long-term care and the special vulnerability for people in our skilled nursing facilities, that we've managed to hit those kinds of numbers so far. In addition, we continue to make sure that we are making the vaccine that we do have available, and I can't stress how important it is for everybody to understand that federal supply is limited. We currently get somewhere between 103 and 106,000 new doses a week. That's not a heck of a lot more than we were getting a month ago. It's up very modestly since this program began at the end of December, but the long story short here is we probably have about 4 times the asks in from folks who are in a position to administer vaccine around the Commonwealth than we have available vaccine to distribute. And I've said several times that we had assumed, based on a lot of the dialogue and the conversation that had taken place with the federal government and with others, that by the time we got to the end of February, there would be a really significant increase in the amount of vaccine that was available to be distributed. So far, that's not materialized, and I and every other governor in America continues on our weekly calls with the folks in D.C. to press them on when we can start to see a significant increase in available first doses. Obviously, the second dose stuff follows the first dose, 3 weeks, 4 weeks afterwards, so that the total number of vaccines that are being administered grows along with that. But what people really want to know is, when is the first dose weekly supply, not just here in Massachusetts, but across the country, going to move from where it is now to a more significant level? The other big issue is visibility into the supply chain. This is something that states talked a great deal to the feds about last year, and we continue to talk to them about this year. And what that means is, how many weeks in advance can we order supply so that we can start thinking about being strategic about how we make decisions about distribution. So far, it's still 1 week. We can only go out 1 week in terms of making orders and making decisions about how that vaccine is going to get distributed. It would be terrific if at some point, and obviously if and when this happens, I'll be the first to announce it, we get to the point where we can start making decisions about ordering and distributing vaccine 2-3 weeks down the road, because that would obviously make it a lot easier for everybody who's on the administration side of this equation to be able to plan accordingly as well. I do want to thank the team here at Curative for the work they've done with our administration and with the city and with the mall. Thank you again for your help on these issues to make this as convenient and as safe and as effective an operation as it possibly can be for folks here in Western Mass. I also want to thank the folks who are here from the National Guard. I say all the time that I had plenty of opportunities to work with the National Guard over the time I've been in office. You know, you all may remember that 20 days after we took office, it snowed for 28 days in a row. It's been quite a 6 years. But the Guard was there doing all kinds of tasks all over the Commonwealth of Mass to help us dig out from that 28-day blizzard. And I still, to this day, you know, have visions of all those overhead shots of the National Guard literally shoveling out various rapid transit systems where the snow had just overwhelmed the tracks, and day after day, backbreaking out there, just shoveling out the tracks. They did tremendous work in terms of helping get people safely from place to place, medical appointments and all the rest. And with the tornadoes and the ice storms and the gas explosion in Merrimack Valley and so many other circumstances and situations over the past 6 years, the one thing I have learned about the National Guard is when you call, they come. And they are stars. They've been incredibly helpful in working with us on all of our long-term care strategies, which is a big part of the reason why we've had such a dramatic decline in both infections and deaths in long-term care facilities here in the Commonwealth of Mass. And they have stepped up once again to help us with the rollout of this particular program. And I hope you pass that along. I hope you pass that along to the team. You guys are really special, and I want everybody to know that. Here at the mall, 11,000 doses have been, I have 11,000, is that about right? You said 14?
Right at 14,000 after today.
All right. Once again, being conservative. Never want to overpromise. They currently have the capacity to do about 1,500 doses a day. And for people who are visiting the site, I just want to remind everybody to arrive for the appointments that they have, and they should wait in their cars until their appointment times. And I know how anxious people are to get their vaccine once they have an appointment. It'd be great if you came roughly around the time of your appointment. This is something not just here in Massachusetts, but in places around the country. Folks are showing up 90 minutes, 2 hours, way in advance of when their appointment is, just because they're nervous and worried, and I completely understand that. But the message that I would give to everybody is, if you have an appointment, your appointment's going to be honored, and the vaccine that you come to receive is going to be delivered to you. And as you can see from what's going on here today, people will take good care to make sure that you get in, that you get checked in, that you get vaccinated, that you wait to make sure everything's fine, and then you can go on your way. And, you know, repeat 3 weeks or 4 weeks from now, depending upon whether you have a Pfizer or a Moderna vaccine. I also want to let everybody know that there are 4,000 openings currently here in Springfield, and then another 9,000 openings that are available at CVS health stores around the region this morning. And if you're seeking an appointment, you can go find one on mass.gov/COVID vaccine. I also want to just say a quick word about the companion program that we announced last week, or was that this week? That was this week. I've been saying since COVID began that every day sort of feels like about a month. We announced that companions for individuals who are 75 years or older would be able to get a vaccine at a mass vaccination site if they came with them. We put that policy in place for one reason and one reason only: to help provide support to seniors who might feel uncomfortable going to a mass vaccination site alone. The policy's been supported by many senior advocacy and support organizations like Mass Senior Care and the Massachusetts Councils on Aging, as a way to help more of our most vulnerable citizens get vaccinated. Seniors should only enlist a trusted companion to do this, like an adult child or a spouse or a neighbor, to bring you to your appointment. We have heard disturbing reports in some cases of people trying to take advantage of this program and offering to pay seniors so that they can take them to appointments. That obviously is unacceptable and completely inconsistent with what we're trying to do here. Seniors, if you do get a call from someone who's offering to take you to a site, you really ought to report that to authorities. I also just want to close by saying the 211 number we set up for vaccine scheduling as a resource tool for seniors who are 75 years and older, who can't access an appointment using a computer, has turned out to be pretty effective. Beginning today, because of the effectiveness of that program and the popularity of it, we're extending the hours to include weeknights and weekends. The new hours will be Monday through Thursday from 8:30 a.m. to 8 p.m. and Friday through Sunday from 8:30 a.m. to 5 p.m. I just want to remind people, this is supposed to be for people who are 75 years old or older. The good news on this is these sites, I can't tell you how much feedback we've gotten, especially from senior citizens and their kids, and in some cases their spouses, about how much they appreciate this opportunity to get vaccinated at sites around the Commonwealth. And almost to a person, the message has been how efficient, how safe, and honestly, how friendly the whole process was. And we look forward to continuing to move forward with the supply that we have. We hope and anticipate that at some point the feds will change that number, because at this point we have far more capacity to deliver vaccine than we have available vaccine. And I would really like to get to the point where we are in the business of delivering as much vaccine as we possibly can, given the capacity we've built to the people of the Commonwealth, because let's face it, this is a big part of helping us get over COVID and put it behind us. And with that, I'll stop, and I'm happy to take questions, and I'm sure the mayor and the folks from Curative are too. Yeah, go ahead.
There have been a lot of problems this week with the vaccine rollout. What's your administration going to do to fix those problems?
So give me a for instance. Well, it's easier for me to answer if I know which ones you're asking me to comment on.
There have been criticisms about the buddy system, limiting doses for hospitals, and people having to wait out in the snow.
So with respect to hospitals, hospitals currently get about 40% of all the vaccine that we put out there for the following week. And hospitals and healthcare systems are going to get about 55% of all the vaccine that's available next week. They are major players and continue to be major players in distributing vaccine. We would love to be able to give everybody all the vaccine that they ask for, right? As I said in my remarks, we have about 4.5 times as many requests as we actually have vaccine that's available. I hope at some point the federal government finds a way to enhance the manufacturing production associated with vaccine. I can tell you that every governor in America is anxious to see what they do with the J&J data that they received. J&J obviously has a third vaccine that's currently in front of the FDA. And on every call I've been on with the folks in D.C., almost every governor to a person who comments, one of the big questions is, we have built, all of us, infrastructure that makes it possible for us to do far more vaccinating than we actually have available vaccine to distribute. And the frustration that people have with the fact that they have capacity to distribute but don't have vaccine is something happening here in the Commonwealth and across the country, and it's very much my hope that at some point we really do have more supply than we have capacity. That's not now. With respect to the buddy system, this one's really simple. People over the age of 75 are far more likely to die of COVID than any other population group. And they are also a group that, in many respects, is somewhat intimidated by big trips to places they don't know. And we had a lot of folks say to us, geez, we would love to find a way to get more seniors to come and get vaccinated, but they don't want to ask somebody to take them. They're nervous about having somebody take them that they don't know, and a number of organizations that work directly with seniors, including the Councils on Aging, Mass Senior Action, and several folks in the healthcare community, the Mass Nurses Association, for example, were the ones who suggested to us that if we came up with some sort of a buddy system, that might be the thing that gets the neighbor or the son or the daughter or the spouse to nudge their family member over 75 into coming out and getting vaccinated. And I certainly hope that turns out to be the case, because the sooner we get a big piece of the 75-year-old community vaccinated, we can start talking about vaccinating the 65 and plus group. But I'm uncomfortable moving on from where we are until we've demonstrated that we've made it possible for as many 75-year-olds as possible to get vaccinated, because they're the population that in many respects is at greatest risk with respect to COVID. Yeah.
I was going to say, are there concerns, though, that with younger residents taking the vaccine doses, that there won't be enough for the older population to be able to move forward to the next step of the phase?
I think our view is we would much rather vaccinate more 75-year-olds and along the way vaccinate a few folks who aren't 75 than end up in a situation where a whole bunch of 75-plus folks just don't get vaccinated at all. Goal number one here is preservation of life, right? And there's simply no community for whom COVID is more dangerous than the over 75 crowd.
Governor, are you disputing the complaint from hospitals that they have received, that they're now receiving less vaccine, and that's why they can't schedule any more appointments?
No, what I'm saying is that they're still getting the largest share of any group in Massachusetts, and hospitals plus healthcare systems, not counting community health centers, are getting more than half of all the vaccine that's going to be distributed next week. What I'm saying is that the asks, the capacity that we have in the system at this point, to vaccinate people is far bigger than the number of doses we're actually getting from the federal government. And I can't distribute supply that doesn't exist. And I would like nothing better than to be able to answer every single ask we get for vaccine with supply. But until we get a lot more supply from the federal government, that's just not going to be possible, which is one of the reasons why we end up doing what we can to make sure that we balance the distribution and that the people who get this vaccine put it to work. It's very important to us that the people perform pretty quickly. When they get the vaccine, we want to see them turn around and put it to work. And one of the things the mass vac sites have been very good at is putting to work the vaccine that they get through this distribution process.
Is there still enough vaccine going to places that are going to target, populations that aren't necessarily going to have as much, access? I mean, you don't have cars, there's only 2 bus lines that are coming here. Dozens, thousands of residents in Springfield aren't necessarily going to get here, to say nothing of people that live farther away. I mean, is that balance being undertaken properly?
Well, we're certainly, we have 54 community health centers that are currently participating in our program, and we've provided them with financial resources and other support to expand their ability to deliver vaccines. They were incredibly important partners in our testing program, and we expect and anticipate they'll be big partners in our vaccine program as well. And those 54 community health centers, many of them have multiple sites, and we've worked with them to broaden their capacity to serve both their patients and their neighborhoods. And I think in many ways, again, there too, we're going to end up having to deal with issues that are associated with supply constraints until we get more. One thing I do want to say is, I don't know, we have an 11% of the population of Massachusetts has received a first dose, which is actually pretty good. That puts us in the top 20 nationally in terms of state-level participation among your percent of population that's gotten a first dose. Berkshire County's at 13%, Franklin County's at 11%, Hampden County is at 9%, and Hampshire County is at 11%. So we got a little work to do in Hampden, but Western Mass generally is doing well.
Last question.
Just any plans in the works to get more mass vaccination sites out in this area, or is it still a little too early?
I have more. We have more capacity than we have supply right now, and we built that capacity because we were anticipating that at some point the number we were going to get from Washington was going to go up. We've now done this a number of times, and I think if we got some visibility into the fact that you're going to be able to order 2 or 3 weeks out, and that third week you're going to be able to order, I don't know, 25–50% more than you ordered before, I think we would probably start within the existing distribution channels we've got, because as several of you have pointed out in your questions, there are people who feel like they have capacity that we can't use right now. But if we got to the point where we had issues with respect to our ability to absorb the supply and turn it around and administer it quickly, we would certainly consider opening up more spots. The other thing, as I said, we do keep very careful track of what's going on from county to county to county, and it's important to us that the counties overall perform somewhere around the statewide average in terms of percent of the population that's actually getting vaccinated. I do want to give you a chance.
Thank you, Governor. Appreciate it. So you talk about wait time, about people in Massachusetts, false doctors coming 90 minutes early, waiting them to call a card. What is the appropriate time to come to my appointment so I don't have to wait outside or anything like that? What is your administration's suggestion?
I think people showing up anywhere inside 30 minutes is probably plenty. If you were going to the doctor's office, for example, or you were going to a community health center, or you were going to the collaborative that Berkshire County has set up in Western Mass, which has a bunch of different locations, if you came there somewhere around 30 minutes in advance, you'd have plenty of time to get from your car to where you needed to go and to get checked in. I don't think people look, I say that recognizing and understanding. I mean, I'm 64, so I have a lot of friends who have moms and dads who are in their 80s and 90s, and I totally get the the concern that people have about, I got this appointment, I want to make sure I get there in time, I want to make sure that I get the vaccine. And what I would just say is that, you know, everybody who's playing on this provider side, whether you're a health system or a hospital or a mass vac site or a community health center or a local board of health, these folks are all organized around a similar model that involves welcoming you in, checking your credentials to make sure you are who you're supposed to be, setting you up, getting you vaccinated, putting you in an area where they can watch to make sure you don't have any issues with respect to the vaccine you just got, setting up your second appointment, and then saying they'll see you again in 3 or 4 weeks. And if people come, you know, if people are nervous, I really think the farthest out they need to go is 30 minutes.
Thanks, everybody.
Thanks for coming, and thanks to Curative, and Mayor, thank you again for your partnership on so many issues.